Hello, good afternoon, everyone. Welcome to, again, another community advisory group. I want to welcome all of you. It's great to see all of your faces. I want to welcome all of you on behalf of myself, Mr. Castillo, Greg Hodge, our other co-chair of this group, and the Director of Public Health, Kimmy Watkins-Tart, to another great meeting. We have a great agenda for you tonight. Before we get started, I do want to do a land acknowledgement because yesterday was Indigenous Peoples Day. And so we know that this is unceded Ohlone territory and that we need to begin not just doing a land acknowledgement, but begin the process of returning land back to Indigenous people. So we need to move beyond the symbolic and the rhetoric and begin moving towards the material recognition that this is unceded territory. That is a complicated process and not one that we are going to be discussing tonight, but that we should begin having discussions around. Tonight, we have an agenda that includes, as always, doing a little bit of partner updates, doing a little bit of where we are in terms of COVID, our response, where we are in terms of our hyperlocal vaccine media campaign, as well as doing a little bit of the deep dive on where we are in terms of our schools and safe learning team. And then we'll have time to do a little bit of discussion, as well as maybe some taking a poll or getting a sense of what folks would like to see in our future meetings and whether or not we should be meeting in December. So how does that sound? Does that sound good with folks? All right, taking a good, I can't really see everyone now because of the Zoom setup, but it seems like we're all on board. And so I want to invite our, and of course, if you are new to the space, please feel free, and if you're not new to the space as well, but please feel free to introduce yourself in the chat. Let us know where you're taking this call from and how you're feeling today, whether what your energy is like, so that we can get a little bit of that energy to get us through this afternoon meeting. So now I'd like to invite our partners to give a little bit of an update. Maybe we can start with the Umoja Youth. I know that the Umoja Youth have an update for us. Do we want to start there?
This is Lauren. I am not sure they are here yet. I did just speak with them about an hour and a half ago, but I will keep an eye out. So maybe we see if anyone else has updates first.
Okay, thank you, Lauren. In that case, let's open it up for anyone else who has a brief update, a partner update to share with the group. Oh no, I saw Dr. Rhodes unmute, but maybe it was just Dr. Rhodes was just maybe joining the call. I wasn't sure if you were unmuting to give it an update or not, and you're always welcome to.
Is it community update time?
Yes.
Okay. And I think some of my youth mobilizers are gonna join us, and they might want to say a little something. So I don't know who has control over allowing them to speak because they're coming in on the generic link.
Let me know whose names to look out for. This is Lauren.
Zahir Khan and Kanoa, K-A-N-A.
I
You can
believe
find them. They should be
Zahir is in here already. Go ahead.
So we are, I guess, kind of pivoting our focus to, with Umoja, kind of to elevate the youth voices. I mean, you see that in just kind of working with the youth mobilizers and starting to try to break into that social media space. But we're also, you know, continuing to be in locations where our community partners and those who've been with Umoja for a year plus are just doing regular events, which seem to be kind of taking off. I think the big question that I had, kind of two questions just in terms of moving forward with the focus starting to shift. Like, yes, there's booster shots and that's mostly in an older population, but as we shift to start to think about vaccinations in schools, are we going to start to get data around the schools and what is that workflow going to look like? And I think I'd love to hear some response to that this evening. And then the other thing is that we did have some interaction where our Castlemont partners, the vice principal had gotten some emails saying that there would no longer be services on campus. And we are really enjoying that partnership. We have observed that after being it took us 3 times of being at Castlemont before the African-American kids would actually approach us and have conversation. And so what we know is that is like a real time commitment and a real, like it's gonna require a real relationship before we can be in that dialogue. So I hope that we're not gonna get hamstringed and pulled out of those scenarios before we have a chance to really start to interact with some of the kids and hopefully be a positive influence on how they're thinking about what they're doing. And then I guess lastly, I would say that we are also having some conversations in collaboration with Marcus Foster to talk to both Castlemont administration and McClymonds administration to think about how do we engage the kids in actually learning about pandemics and then incorporating that kind of stuff into the curriculum. So, some of your math class is like basic statistics on, what are the rates of infection and, it's easy to talk about social determinants of health there and health outcomes. Like there's such an opportunity to teach so many different things and have the students be activated citizens in the process. So we hope to be able to be a part of that. I think, it's partly happening because my team is relatively young and because we don't look like, the establishment. We look like, fun people in t-shirts who are handing out food. So that's our update. And I feel like that's the inspiring part of what could happen going forward.
Thank you, Dr. Rhodes. Michelle, did you have a response to Dr. Rhodes? I see your hand.
I just wanted to share on the data front. And I know we're going to talk a little bit more about schools, but I just wanted to be responsive to that comment about data. We are working right now. Most of our school districts have dashboards posted on their individual websites. They are not all reporting data using the same categories. And we are trying right now with the schools to standardize their categories so that the data that's available to us is clean data. Lisa Erickson and I have been working with the superintendent and the school leaders to standardize the data format so that we can get better data from schools. And that process is happening right now. And I'm hoping in the next week or two, we'll have some aggregated county data and then links to all of the district dashboards where people can see what individual district data looks like.
Thank you. I believe the Umoja youth are now here. Saher, I saw. And the other youth was
Kanaya's in here. I think I see her too.
Yes, I do see Kanaya.
So,
Saher and Kanaya, the space is yours.
Hi everyone. I'm Saher. I hope you guys are having a good day/night. I'm a co-lead for the Youth Mobilizers program. So I don't have a presentation for you guys today, but I just wanted to give you a quick update about what we're working on right now. And we talked about this in the Umoja update meeting at 4 p.m. So we've began to create some content and we have 3 things that we're working on. The first is a series of skits that we're going to be doing. The youth mobilizers are the ones who will be participating in the skits. So we have 2 that are in the works right now. The first is kind of about the way COVID-19, the virus interacts with an individual who is vaccinated versus is not vaccinated. And with this, we really hope to illuminate how the vaccine protects us from the virus. The second is an interaction between someone who wants to get vaccinated, but is skeptical or may have some doubts. And they're going to be talking to a quote unquote healthcare professional who is able to answer some of their questions. And with this one, we really want to illuminate the frequently asked questions and concerns about the vaccine and provide some answers. The second thing we're working on is a virtual FAQ card that's going to be given out at our events. So this is a new way to kind of share information about the vaccine that's already out there. Because we have the information, we just can't get it out to like where everyone has access to it. So with the FAQ card, it'll have a QR code in the front, which will link to a database with all the frequently asked questions or concerns that people may have about COVID. And this way, when someone has a question that you may not know the answer to, you'll have access to this database. It's easy to access. It'll be virtual and up to date. Because it's be a working document, we can keep updating it as we get new information or as things happen with the virus. And the last thing we're going to work on is we are working on a reaction video with some of our own professionals, such as Dr. Noha. And we're sort of reacting to some of those extreme viral videos that are out there. And we want to share like Umoja's perspective or a healthcare professional's perspective on some of these videos. And then I want to invite Kanoa, who is one of our youth mobilizers, and he's going to talk a little bit about our experience in the field, being out there and working on getting people vaccinated.
Hi, everybody. I'm Kanoa. I'm part of the Umoja Health Youth Mobilizer Program. And I feel like from my experience being at Castlemont and some of these live events, I feel like initially there's some weary like feelings. There's people who are not 100% sure about their decision or are maybe willing to take it, but not at the moment. So what I've noticed is maybe initially somebody will show up by themselves or maybe with a couple people and be weary about it and then have an opportunity to think about it or sit on the thought of it. And then eventually they'll come back maybe by themselves or with more people. And I feel like just having the resources there is a big part of people's decision, being able to have the option to do what they want, what they feel is right. So I feel like a lot of positive feedback we've got was not necessarily pressuring people, but letting them be able to take their own time and their own will to participate. And yeah, I feel like it's been pretty positive in those aspects.
So, hello everyone, this is Kanaya. So I just want to add a little to that. In addition to us creating the scripts and really creating a more social media approach of more like factual information when it comes to the vaccine, we are also still pushing out our survey to collect data and figure out what is holding people back from the vaccination, and also just their feelings around the vaccination. And also we are still hiring. We are still looking for youth to help us with some of this work. And we are going to all the pop-ups to encourage people to get vaccinated and to just be like a younger face that they can see and that they can kind of look up to, access for more information, and maybe we can just help our land at this point.
Great. Thank you to the young folks working with Umoja to do that great work. I believe we have time for at least one more partner update. If anyone has anything they'd like to share with the group.
I don't know, Nestor. It might be a quiet night tonight.
Yeah, están bien calladitos. We're quiet tonight. Okay, that's all right. We will now, maybe something will come up and we'll have a little bit of space towards the end. And so if that's all right, we will still have time for discussion towards the end if anything comes up. So why don't we now move to Kimmy, and Kimmy's gonna lead us through this next section.
So this next section is really an overview of what's going on, all things COVID. As you all remember, when we started this off, we were focusing more explicitly on vaccine distribution, and that still is a large part of our discussion, but we have since expanded our overview to cover more than just vaccine, but also to give policy updates, to also share information about our operation, which is inclusive of things that you all had been asking about, like what's going on with the schools, how are we doing this, how are we doing that. And so we have presenters tonight that will be sharing information about the different parts of our operation, starting off with Dr. Nick Moss, our county health officer, who will share with us where we are in terms of data and a lot of the policy updates that have happened since we last met. Some of them are very new. Donata Nilsson will then share what's going on in the operations of our response. And Lisa Erickson and Kiko Mallon will cover and review and go over and talk about, and actually it will be a deep dive, it won't just be an overview a bit, about what's going on with the schoolwork and our collaboration with the schools in Alameda County. So I will turn it over to Dr. Moss to start it off. Thank you.
Thanks, Kimmy, and good evening, everyone. Let's see, next slide, please. Okay, so pretty dry slide here, but a brief overview of where we are with COVID in Alameda County. So we are down to a daily case rate of 7.6 per 100,000 people, peaked close to 30 during the summer wave, and closer to 50, even a little bit over during last winter wave, to put it in perspective. About 100 cases of COVID are reported to the health department every day right now. And of course, that's not everybody who's infected, or even everybody who tests. We don't know about people who test at home necessarily, but that number is dropping. Test positivity down to 1.6% for the county overall. In our Healthy Places Index, first quartile, that's the quarter census tracts in Alameda County that have that are most disadvantaged on this scale called the Healthy Places Index. So it's a measure of different socioeconomic challenges. The positivity is 2.2% in those areas of the county. And we know it's not on here, but we know with our county supported testing sites, we are seeing higher positivity still in a few parts of the county, higher even than this. So it's definitely a range. We are at 87 people hospitalized, down from about 240 at peak this summer, 38 in the intensive care unit. Testing across all providers in the county continues at a very high level, higher even than where we were during most of the winter surge. There have, so far, we are aware of 89 reported COVID deaths from July 1st to October 2nd. 70 of these people were unvaccinated. We're still looking at the details, so this is preliminary, but most of the 19 deaths among vaccinated people were in very older adults who would, if you've been following the booster news, are now eligible for a booster. Next slide. This is the sort of the day by day of reported cases. The reason it has that sawtooth look is less is reported on the weekend, just because fewer people are getting tested on certain days of the week. But you can see things have dropped quite a bit since the middle of August. They're starting to flatten out a little bit if you squint. Next slide. So here you see that same information expressed as a rate, number of cases per 100,000 county residents per day. And again, you can see that we've come quite a bit down from our peak, although not quite as low as we were on July 1st on the far left of this figure. And again, maybe a little bit of flattening on the far right. That yellow line, that is the threshold for moderate transmission on the CDC's metric for community spread of COVID. We're at the very bottom of substantial transmission, and we're knocking on the door of moderate. So next slide, please. CDC actually maps this. You can check this every day on the CDC's COVID data tracker website for the whole country. Most of the country is in red or high community transmission of COVID. There are a handful of counties, mostly less populated counties, that are in moderate transmission or substantial transmission. You can see the Bay Area and some large counties in Southern California as well, actually doing better in this orange category, substantial transmission, doing better than most of the country. And as I said, we in Alameda County are knocking on the door of yellow. I checked this today. Marin County actually did pop over into yellow. So really, some of this is due to high vaccine rates in the Bay Area, and some is due to high mask use, and some is probably just due to the fact that we went into this summer wave a little bit earlier, at least in Alameda County, and so we're coming out a little bit earlier than many parts of the country. Next slide. Hospitalizations, I mentioned, are dropping, and you can see still have a ways to go to get back to that July 1st level, but dropping every day. Next slide. Okay, so vaccination progress, and I apologize to if any of my colleagues were going to share the same data later on, but so on our dashboard, 79% of people 12 and up are fully vaccinated. Remember, we are still waiting for vaccine for younger children. I'll have an update on that second. Pardon me for the background noise. So one note on this is that the state has been cleaning up its data, and we are going to be able to actually match people who had a first dose and a second dose. There was a few people who we were counting those doses as if they were separate people. And so the upshot of that is that we're going to be able to move some people from that in the upper left, that 92% bucket, into that 79% fully vaccinated bucket. So it's probably actually closer to about 82% or higher in Alameda County once we match those doses up. And that should happen any day now on our dashboard. Next slide, please. Okay, so I mentioned this. This is just a brief rundown of what we expect for vaccine authorizations. I get confused about the dates about things, but I think the Pfizer booster authorization maybe happened before our last meeting. If not, you may remember that the CDC, the FDA authorized and the CDC recommended booster doses for people who got Pfizer. And there are some different recommendations in there. So FDA is going to consider authorizing booster doses for Moderna and J&J vaccine recipients this week. A bit overdue, I think, but it took a while for the data to come in. So we are anticipating an authorization for those vaccines later this week. And then next week, CDC will meet to discuss those authorizations and make their recommendations. We're expecting that on October 20th and 21st. So finally, now we'll have some additional booster guidance for people who didn't get Pfizer but got one of these other vaccines. And then the other big news: the FDA is going to consider the Pfizer vaccine for children ages 5 to 11 on October 26th, about 2 weeks from now. And then the CDC's immunization advisory committee on immunization practices, they'll meet on November 2nd and 3rd. And we are so far expecting that this is going to get authorized and recommended, and we'll have that in early November, finally, at long last. So one important note, it's a lower dose than the adult formulation. So, it's important to wait, make sure that the kids are getting the appropriate dose when they get vaccinated. Next slide. Okay, so the other thing you may have heard about is last week, the Bay Area health officers for all the 8 jurisdictions that had mask requirements, still have mask requirements for vaccinated people in indoor public settings, set criteria for when to lift those requirements. So I'm gonna just summarize those here. The criteria are 3 weeks in that yellow level of community transmission by the CDC's metric. So that is 50 cases per 100,000 residents per week, works out to about 7 cases per day. And as I mentioned, we're at, I think, 7.6 today. So we're knocking on the door of this. Criteria 2, COVID hospitalizations in the jurisdiction need to be low and stable. And criteria 3, either 80% of the total population, not just the eligible population, the total population is fully vaccinated, or 8 weeks have passed after the vaccine authorizations and recommendations for children ages 5 to 11. And I'll talk a little bit about what that means for Alameda County in a second. But first, some of our neighbors are going to meet these criteria at different times. We have different health systems, where the Western Bay Area is a little bit higher vaccination rates. And then the other thing is that the state and federal masking requirements are not affected by this. So assuming that they stay as they are today, masks will still be required for everyone in K through 12 school settings. Unvaccinated people will have to stay masked in indoor public settings. The Cal OSHA mask rules will remain in effect, and the federal requirement for masking in public transit will remain in effect. Next slide, please. So one possible timeline for this to take effect in Alameda County is mid to late December. We probably need at least some of the 5 to 11-year-olds to get fully vaccinated in order to meet that 80% criteria. And they would reach that 2 weeks after their second dose at the earliest, around about December 10th. I think by my math, if everybody who's got one dose already gets fully vaccinated, we still need about 60,000 people to get vaccinated to reach 80% of the total population. So we probably need some children to get there, maybe not. And then if we don't hit that 80% before the very end of the year, around New Year's, we'll hit that 8-week mark from the authorization for 5 to 11-year-olds, based on what we know of the FDA and CDC's plans. I think we're going to meet the community transmission and hospitalization metrics much earlier. As I said, we're close to yellow now. Hospitalizations, we're looking at a local measure. Each county is defining this a little differently. Basically, the threshold is our average COVID hospitalization bed occupancy in between surges. And that's a little over 3%. So a little over 3% of our hospital beds are occupied by COVID patients when we're not in a surge. And so we're going to use that likely as a benchmark for the hospital status. Now, a late fall and winter COVID surge could slow our progress here. Hard to predict. Certainly, the more people we have vaccinated, the better, based on what we saw this summer. Some local health jurisdictions are relaxing mask rules earlier in certain 100% vaccinated closed settings, like non-public facing workplaces and gyms. So be aware of that. Well, all we're doing right now is just looking at those policies, but it is happening with some of our neighbors. Next slide. And that was it for me.
Thank you, Dr. Moss. Donata, you're up next.
Thanks, everyone. Good evening. Next slide, please. So overall, we've had a decrease in our inquiries and vaccination call lines. Just to give you a quick update of what's going on in our COVID division, our cases and as Dr. Moss mentioned, our cases have been decreasing. Our outbreaks have been also decreasing. We've continued to support calls to individuals who have missed second doses and facilitate scheduling of homebound vaccination appointments. So even though our call line volume has decreased, we continue to reach out. We are also taking referrals right now for unvaccinated cases and contacts who have finished isolation and quarantine. And then we are continuing to support schools. As I mentioned, overall, our outbreaks have been decreasing. We rarely see outbreaks in our healthcare facilities, and workplaces have also gone down. We're still very busy supporting our long-term care facilities, and we are also very busy still with our schools. Our testing team will continue to identify co-location of testing and vaccination, and overall will continue to focus on contracting with our CBO contractors. And our community vaccinations are going to be continuing to focus on our unvaccinated populations in our county. So just to remind you, we have 4 main units in our COVID division, which is the case investigations contact tracing unit, that's that blue section up there, along with our partners, our CBO partners who are assisting us with CICT work. We have our outbreak investigations, our community vaccinations, and our community testing. So you can see there what our focus is. Again, I mentioned schools and our shared portal for outbreak tracking, where our schools submit cases and contacts. We also continue to focus on complex cases and exposure events. And then, as I mentioned, the vaccination call lines and the community support work. Our CBOs right now are continuing to focus on priority zip codes, but we're also working on training them in the SPOT portal. Our outbreak investigations will continue to focus on the SNFs, the schools, and the shelters, and correctional facilities. In our community vaccination, as I mentioned, we're focused on unvaccinated individuals in our county. As Dr. Moss mentioned, we're at 92% right now. And then we're supporting our long-term care facilities for booster vaccinations, mainly through our contractors, but we also have a small homebound team that will also try to support those facilities. And then our community testing will continue to focus on priority neighborhoods. Next slide. This is just a reminder of who is helping us with vaccination. So it's definitely a collective effort in our county to do all of these vaccinations. Our healthcare system, going from bottom up, our healthcare system partners have done quite a bit of the percentage of the vaccinations overall in our county, along with our large pharmacy partners. And then you can see when we had our mass vaccination work going on, we had the Coliseum and the FEMA mobile trailers assisting with those vaccinations. And then our community-based partners and our health centers continue to assist with vaccination, along with our Alameda County Public Health Department staff. So with that, on the next slide, we have been working with our data team to come up with some benchmarks internally to, especially when we are working with our partners to do outreach. I'll share a little bit more about the DOOR project in just a moment. But at the end of July, early August, our goal was really to vaccinate at least 80% with at least 1 dose. So by the end of August, the data here shown is a 9/8 data. We actually made it up to 89% of 12 and over that had at least 1 dose. Wow. And our second goal was for early October, which we'll be looking at the data this week. We had hoped to get 95% of 12 and up with at least 1 dose. We're currently at 92%. And as Dr. Moss shared earlier, with some of the matching of the data happening, Soon, that percentage may drop just a little bit, but our fully vaccinated percentage may go up slightly. And then on the next slide, we were really focused on the African American population. At the end of August, we were hoping to go from 84,000 to about 90 to 95,000 vaccinated with at least one dose. And we actually reached over 94,000 at the beginning of August. We hope to have a 10% increase over 6 weeks, and we actually did 12% increase over 6 weeks. And overall rate, we were hoping to go from 60% to 66%, and we were able to accomplish 67% with at least one dose. And our goal right now for 10/13, which is tomorrow, is really to increase from that 94,000 to 103,000, and an overall 9% increase over 5 weeks. So that data we'll be sharing with you next time, but we continue to use data to drive our strategies. And then on the next slide, basically similar data for the Latinx population. We had hoped by the end of August to reach about 200,000, from 186,000. Our result was over 210,000 vaccinated with at least one dose, which was a 10% increase over 6 weeks. And we actually were able to do a 13% increase. So, and that's our 9A data. And for our October benchmark, we're looking at an increase from 210,000 to 230,000. So that's a 9% increase over 5 weeks. So again, that data is forthcoming. We'll be looking at that this week and be sharing that with you at our next meeting. On the next slide, this is just a reminder that on our webpage, we update on a weekly and even monthly basis all of the vaccination sites that are open to the public, where people can get vaccinations, first and second doses, and we continue to provide all 3 vaccines. Next slide. And then just a quick update on the DOOR project. This is our direct outreach to our residents program. These are activities as of 10/11. So we have been able to knock on and attempt reaching folks at over 55,000 homes. And we've had over 13,000 conversations. If you remember, the DOOR program launched on July 17th in collaboration with Public Health and Kaiser. And it was really focused on attempting over 90,000 conversations over an 8-week period. So at this time, since the DOOR project began, our vaccination rates have gone up 10% in the DOOR census tracts. We had 23 specific census tracts, and there'll be a slide on that after this to show you where those census tracts are. Over 12,000 residents have gotten vaccinated in those tracts. And we also make sure that residents bring some of the DOOR outreach materials to our vaccination sites so that we know how they have been reached. So that's one thing that we're trying to track at our stationary pods to see how people have heard about our sites. On the next slide, you can see some of those census tracts. Again, we were targeting 23 specific census tracts where there were low vaccination rates. And the number of homes estimated, that you can see there at the top left, approximately 50,000 homes for African American Black residents, 20,000 for Latino Hispanic residents, and then overall other was 38,000 who were unvaccinated in those census tracts. So you can see the map is color coded. The smaller light blue are the specific census tracts that we were targeting, and then the larger square boxes represent where we are, where the progress is to date. So for the red boxes, we've completed 36,000 attempts in West Oakland, Ashland, Cherryland, and also South Hayward, Union City. The green box is East Oakland. We've done over 8,000 attempts. And then right now we're in the early stages in those blue boxes, working with Newark, Livermore, and Central Hayward. Next slide. And then just a quick overview of where we are with our testing. Dr. Moss had already shared that our positivity rates, what our positivity rates are. They are down at 3.4%. This is specifically focused on our contracted testing sites. We are seeing higher positivity rates in some of our priority areas where our contractors are primarily situated. Our highest positivity right now is Livermore, East Oakland, and Hayward, Cherryland areas. We are right now working on continuing our CBO contracts through next year. So those contract negotiations are in progress. And then the final slide is just a reminder that on our website, on the next slide, you can see that where you can look up the testing dashboard. So our total number of tests that we've done, where we are in terms of the total number of tests and the 7-day averages, some of the data Dr. Moss shared earlier. But this is again updated ongoing, so you can always get the most up-to-date information there. And that is my update.
Oh, sorry, I'm on mute. Thank you, Donata, for that. Yes.
I think we have a couple of questions that might be answered by Donata and by Dr. Moss.
Okay, absolutely.
There was one regarding vaccination proof being required in the county, and another question, I believe, in the Q&A that might have been answered already. Yeah. Okay. Great.
The question in the Q&A was about vaccine effectiveness for the different vaccines, and or really what it was what breakthrough do we have data on breakthrough infections in Alameda County by vaccine type? And we have incomplete data, but what I think is more helpful is the CDC has recently published a very careful study of this that shows the difference in performance of the vaccines during Delta for both severe disease, which is what we care about the most, and also breakthrough infections. So I posted that link in the Q&A, and I recommend people who are interested in this to check it out. Bottom line is they all perform very well, but Moderna is best. Pfizer lost a little bit during the Delta wave, and J&J has the lowest effectiveness, although still very good, better than what we see like with the annual flu shot. So that's sort of the upshot, and I have no reason to think Alameda County would be any different. And these data are informing this booster shot conversation. So I think we're going to learn a lot about strategy for people who got different vaccines next week when FDA, and then this week and then next week when FDA and CDC consider boosters for Moderna and J&J recipients. And then the other, yeah.
Sorry, Joe Greaves actually put a question into the chat that I think is the one that
yeah, I'm going to answer that.
Okay, sorry.
So the other question is that there's no health officer order requiring proof of vaccination at concerts, festivals, gyms, and bars in Alameda County. Some may know that the city of San Francisco, the city of Berkeley, and Contra Costa County have introduced this type of vaccine requirements and settings. And then other jurisdictions in the Bay Area have not. There's a few other places, LA and New York, most notably, that have done something like this. So there's a few reasons that we haven't done it locally. Most importantly, we don't really have the resources to support countywide all of the businesses to implement this in a way that makes sense. Berkeley and San Francisco are a little different in that regard. I'm impressed that Contra Costa is able to do it. And then we don't have an enforcement mechanism here locally either. We don't have a public health enforcement team. I think we sort of relied on a soft touch approach in a lot of settings from the county-wide side with our health officer orders, but I think this is one that would be very difficult to not have some enforcement attached to it. And then there's a few other issues, which is I think that we certainly really support any effort to get vaccination rates as high as possible in the county. And this would clearly do that, particularly for younger people. And we're trying to find other ways to support businesses to or incentivize businesses to do this sort of thing. So there may be some things that we can do locally that that at least partially get us there. And then the other thing is, I think, you know, from our standpoint, while getting vaccination rates as high as possible is important, we want to be careful using, I mean, the health officer authority has been relied on for a lot of things in the pandemic, and it isn't always the best tool to use. I know some jurisdictions have relied on it, but I think there are other people who have the ability to introduce these types of restrictions if it's right for their communities, and I encourage them to consider it. And lastly, I'll just say, you know, I think vaccinated people are often interested in this type of restriction, and but vaccinated people can get and spread COVID, particularly when they're unmasked. We learned that with the Delta wave. They're probably a little bit less likely to be infected, so there's some protection there, but it's not going to eliminate COVID transmission in these settings with this type of policy. But you will get vaccination rates up higher. So I think that's really the argument to do it. But sometimes people think this is gonna add to protection for vaccinated people. And I think we have to just be careful being realistic about what we're doing with this kind of policy.
Thank you.
And it looked like there was asking, sorry, Kimmy, do we want to hold this to the end, or is now still a good place? Let me ask for that clarification first.
Why don't we take one more question and then let's move on, and then we'll have a couple of questions after Tweri's segment, and then go to schools. We have 2 more segments to go. So one more question I think we can take.
Sounds good. Thank you, Kimmy. There was a clarification around the Pfizer booster. Is it a 3rd dose of the same recipe as the 1st and the 2nd dose?
The Pfizer booster shot is the same recipe as the 1st and 2nd dose. The vaccine for children for 5 to 11-year-olds will be a lower dose. And then just to keep us as confused as possible, I believe that Moderna has requested a lower dose for their booster formulation from FDA. We'll learn more about that probably later this week.
All right. So I neglected to also highlight that Tweri Anderson will be sharing with us some work that we're planning as an integral part of our COVID response communication. And so I'm going to turn it over to Tweri to talk about a hyper-local vaccine media campaign.
Thank you, Kimmy, so much. Thank you for allowing me to be here. Next slide, please. So it's my great pleasure to really represent the HCSA communications team to share with you many months, many minds in planning hyper-local vaccine media campaign. And so this campaign is a paid media campaign that is really looking to get to the treetops, as our communications director is talking about. You know, we've vaccinated folks who, you know, the lower hanging fruits, and through all of our efforts, you know, we've continued to grow our vaccination rates. And this campaign is really endeavoring to meet some of the populations. I think one of the folks here, Kyoko, was talking about certain areas within the county who still have lower vaccination rates, much lower than our average. And it's really designed to meet those folks, those areas with information so that people can make decisions in their time. I think Sahar or somebody from the Umoja Youth Mobilizers was saying their time, you know, with as much information as possible. And so all of this is very much driven by the same data that we're using across the response. It is informed by community through our various engagements like the DORA program, our community navigators at different community tables. And this campaign is really aiming to be digitally focused, though we will have a streaming television component and some print media in language for people who English is not their first language. And we may look to do some out of home as well. Next slide. So I basically just talked about that. It's in the ecosystem as part of the larger COVID response, like Kimmy was saying. And we are in a continual feedback loop with all of our community facing partners who are within the agency and our community organizations doing this work to make sure that the messages are landing the way that we're intending them to do so. And what's really wonderful about this digital campaign is we can pivot very quickly versus something like a billboard or a print campaign that once your collateral's printed, you know, you're stuck with it for however long you're running the campaign. So it'll be really important for you all, folks who are facing and working with the community, if things aren't working or if you're hearing of messages that we really need to focus on, please send them my way because we really want this to be effective. Next slide, please. So this is kind of the process, what we're going to iterate. So we're aiming to launch the campaign sometime in the next 1 to 2 weeks. And what's really wonderful about the algorithms, I know we're hearing a lot of negative things and rightly so about social media algorithms, but what this will do is we will use these digital algorithms to help us refine our messages. That's one way that we're going to do message refinement. And the other way is just with good old fashioned human feedback. And so we're just going to continue to iterate and move this work forward. Again, really making sure that we're reaching the folks that we want to reach to be in choice for vaccine uptake. Next slide. So this is a lot of information. And again, it's based upon the data, the same data that's being used to drive our door census tracks and really our testing and vaccination efforts across the county. And we're continually going to get updated data every 2 weeks based upon, so we may change these primary audiences that you see here based upon the data. The chances are, if we get such a sea change, that would be amazing. Chances are we're going to look to remain to focus on these audiences. Now, this seems like a lot, and I think it's really important for folks to understand because it looks like we can be an inch deep and a mile wide. And really with digital, we have the ability to hyper focus. I think there was a question in the chat, can we do geo fencing? Basically, that's what we're going to be able to do. And that means we can really focus on zip codes. We can't get as granular down to the census tract level, but we can focus on zip codes. And I know that there was some concern around East County and Livermore in particular with vaccination rates. So that is definitely a part of our intended campaign. So that's our qualitative inputs, and then, excuse me, our quantitative inputs, and then our qualitative inputs is what I've already said, that continual feedback loop. Next slide. So these are just some examples. There's many more, but we didn't want to, this is not the message testing space, but just to give you an example of what we're going to be focusing on. So we're running sort of two themes in the campaign. It's your choice with myth busting, just putting out the facts and then allowing, saying, hey, make your choice based upon these facts. And it's really an opportunity or an intent to try to do some combating misinformation. And then we're focusing on just let's live your life and giving positive motivations. And what is the motivator? Engagement with their communities, with folks' families as a motivating force to get the vaccination. And what's really crucial for this work is really making sure, and we've heard this loud and clear from community partners and our own staff, that we have to not just focus on COVID and understand that people are dealing with many unmet needs that might take priority over getting a vaccination. So we need to be mindful and address that and acknowledge it, as well as really ensuring that we're addressing a legacy of medical mistrust in certain communities and in this country, and really sharing facts. So that's in a nutshell, what we're focusing on. We will be doing some A/B testing in this week and next week in live message testing. And what I mean by that is working with people in real time, just saying, hey, these are the images, and just getting feedback. So that's going to inform us as we launch our campaign. Next slide, please. Okay, so this is where we're at. We're finalizing the media plan, and again, finalizing content, refining content. And then we're thinking that depending on cost, this will run about 6 to 8 weeks. It's not a lot of money, but again, you get a big high return on investment with digital. And I think what's next, I think I just shared that, launching our A/B testing and stakeholder feedback. So yeah, that's where we're at. It's really exciting, and we're really looking forward to all the inputs coming in from all of our various efforts, DOOR, our forthcoming community coalitions, our community navigators, our test sites, testing sites, and our mobile vaccination sites, just to continue to learn where do we need to target messages and what are those messages. So thank you so much.
All right. Are there questions for Twary regarding our communications campaign effort? Okay. We'll circle back. Oh, I see Aaron has a question.
Yes, good evening. Thank you for sharing. For the quantitative data, I was wondering, for the Latinx community, what's the actual number? Meaning, is it like 200,000? Is it?
Oh, that's a really great question, Aaron, that I could not answer right now. I would have to look at our data spreadsheets, but I'm going to suspect it's not different data than what we've been dealing with this entire time. It's all the same data. So it's all the data related to DOOR, I'm sure, you know, all of that. So if you want to know an actual number, I mean, I can go back and get that for you.
Okay, no problem at all. Thank you so much.
Yeah, and actually that I do have one thing to say that I think is really important for folks to understand, which I didn't get at first, but this is largely going to be a campaign that most of us won't see. Because it's so geo-targeted and focused, it's not going to be out and about. And if you're not living in the area or, you know, certain demographics or these kinds of things, you will not see it. And it is really our intention to report back, certainly at the next CAG next month, and subsequent CAGs and public-facing meetings, the efficacy of the campaign. So just know that it's running. You can feel free to ask me any questions, but it won't be something that you will likely see all that much, but know that it's happening.
All right. I think we are now ready for Kiko and Lisa Erickson. So, all right, you all have, okay. I have the slides back up.
Thanks. Shall I go ahead? Okay. So hi, everybody. I'm new to this group. My name is Kiko Mallon. My normal job is the Family Health Services Division Director. I know some of you from that work. For the last year, I've been redirected, and I'm currently serving in the COVID response as the Outbreak Investigations Unit Manager. And one of the teams in our Outbreak Investigations Unit is one that focuses entirely on what we call CYCS. Next slide, please. I think explains what that is. Yeah, which is that children and youth in congregate settings is what that stands for. And the reason that we call it that is that we are working to decrease infection among young people, and not just in the school setting, but in other settings where youth gather, including childcares and youth sports, day camps, things like that. So Lisa Erickson and I are going to talk a little bit more about this work. So next slide, please. So again, this is our just sort of the high level overview of our COVID response for children and youth in congregate settings or children and youth settings. And through this work, we support schools, childcare, camps, and any organized activities and classes, sports, things like that, where young people come together. We're interested in thinking about what's happening with transmission of COVID in those settings and how we can decrease transmission, prevent outbreaks. Why are we supporting children in youth settings? Because we want to ensure the safety of children and youth and their families by reducing the spread of COVID-19 in these settings, especially with children going back to school. And it's so important to be able to think about what's happening in those environments in order to have an impact on community transmission as well. We support these settings through a health equity approach, which I'll define in a second, but well, maybe I'll define that first. So our health equity approach is defined, and I think everybody knows, if you're familiar with Alameda County, how core health equity approaches are to our work, defined as achieving the highest level of health for all people by improving the systems and conditions for health of all groups, and especially for those who've experienced racial or socioeconomic disadvantage and or historical injustice. And the way that health equity framework plays out, it's operationalized somewhat differently within the work that we do because it's quite varied, and we'll talk about that a little bit later. But we always have an equity lens in thinking about how we carry out this work. The essential functions that we are doing across our agency, and also with the assistance of ACOE and the school districts, this is a multi-role kind of situation. You'll see in a minute how many different players and entities are involved in thinking about how we respond to COVID in children and youth settings. But our main activities are training, lots and lots of training, technical assistance, and assistance to schools and school districts with the development of guidance and protocols for how to prevent spread of COVID in the school setting and to manage outbreaks, all the reporting that has to be done, that sort of thing. We have our inquiries line, which is a general inquiries line, but through that line, it includes the vaccine line that Donata spoke about earlier. We're able to answer people's questions about COVID, whether those folks be in school, children and youth settings, or other places. Our CICT, our case investigation and contact tracing team, doesn't do so much contact tracing. We'll talk about that in a second, but we do provide some support for single cases and outbreaks. We also work on policy and advocate for policies to be better, to better meet the needs of schools. And one other thing that I've forgotten because we moved to the next slide, but that's okay. I know we have a time frame, so I'll keep moving.
Sorry, this is Lauren. I thought I spaced out and that you had already moved to the next slide, but now I know you hadn't. My bad.
You're good. Thanks. So support with both single cases in schools and also outbreaks. Policy I talked about. We really want to be an advocate to make things as easy as possible for folks managing this in the school setting. We know how busy people are. We have a really strong communications entity that's working on all kinds of communications about COVID. You heard about that from Tweri, and also vaccine planning and implementation. Thank you. Next slide, Lauren. So this is a diagram that shows the COVID response for schools in particular, as distinct from other children and youth congregate settings. And it's a bit of a busy slide, but it shows that, as I said earlier, there are a lot of entities and agencies that are involved in coordinating this response. It's so critical and it's so interwoven and complex. So in the purple boxes, you see functions. So the top one is who's involved in working on contact tracing and outbreaks in the schools. The light blue boxes or bubbles are public health department functions or healthcare services agency functions, including the inquiries line that I mentioned, case investigation and contact tracing, provide technical assistance with managing outbreaks from our children and youth congregate settings outbreak team, our safe learning work, which provides information and guidance and works very closely with ACOE in the orange box. And then those are the blue functions for contact tracing and outbreaks. For student testing and vaccination, ACPHD is also involved in coordinating testing and vaccine. The yellow bubbles here are the roles of our CBOs, community-based organizations that contract with the schools and also contract with us to do some of our case investigation and contact tracing, and also work on SPOT, which is the shared portal for outbreak tracking. That's a data platform that schools are required to enter cases into. Complex, something that we provide a lot of technical assistance in, and that we're very grateful to school staff for spending the time to do. And then the green bubbles on this are the school's role. So the school does a lot of the contact tracing in the testing and vaccination realm. There's also, the school is leading testing and vaccine programs. We are providing more sort of logistics and technical assistance. And ACOE, Alameda County Office of Education, in the orange bubble, is also a really critical partner in assisting with organizing our trainings, facilitating logistics of vaccine and testing. So all of these partners are work together, maybe not seamlessly, but close to seamlessly. We're really working on having a really tight system of coordination to manage this in the schools. And I don't know if Lisa, before I turn it over to you, because you're next, if Michelle, I saw you were on the line earlier, if you want to chime in at all about the role that ACOE is playing in this whole picture.
Sure, absolutely. So ACOE has been, I am on the phone with Lisa pretty much every day, and somebody from ACPHD, we are conversing every day, working on various initiatives with our schools. So I will share that ACOE at this point is maintaining the guidance document that the schools are using. So a lot of that material is generated from ACPHD. A lot of the decisions that we make together about what needs to be in that document, how it's organized, but that is our Bible for our schools. I'm happy to put the link in there if you have not referenced our ACOE, our guidance document for schools. I'm going to put the link in chat. So that you all can take a look at it, but it is it's a much different version of the one that we did for the 2021 school year, which was literally, it was very text heavy and 39 versions in about 44 weeks, give or take. And this one is much more link heavy, resource heavy, direct to the resources, a little easier for us to manage, but we're maintaining that guidance document. In addition, we are creating resources for our schools. We've created, for example, flowcharts to help parents understand what to do in their various scenarios if their child's exposed, if their child has symptoms. We've worked closely with public health on creating those resources. ACPHD has resources. We have them, we share them. We do work on one another's resources. There's lots of infographics and sharing of that information to make sure that schools have flyers to get out to families, things to pin to the side of their refrigerator, all of those points of reference that families really need. In addition, we are continuing to organize the calls weekly. Dr. Moss and Lisa and Dr. Locke participate. We have generally pretty close to 200 people every Thursday on a call, and those are school leaders, school board members, and folks that have immediate questions. We run a robust Q&A session, as well as providing them the updates, the kinds of updates that you all are seeing tonight. We are the central point for schools. We're working again on data-related issues and keeping in touch with the public school superintendents, as well as the other school leaders. And then we are working right now on assisting with the planning for the youth vaccine for that 5 through 11 vaccine group. We're working on being a connector for both public health opportunities, healthcare providers, and that, so that families will know very quickly once that vaccine is approved, where they can go to get it. Because I will tell you from my perspective, and I think many others, getting those 5 through 11-year-olds vaccinated feels, if not like the finish line, but that we're much closer to getting back to a relatively normal looking school setting than what we've been experiencing, obviously, for the last 21 months or so, as I always feel like I need to count those months because it's been a minute. So yeah, we're working really, really closely with public health every day.
Thanks so much, Michelle. It's definitely been more than a minute that we've been at this all. But thanks for being willing to chime in today. I really appreciate it. And yes, you're working so closely with you, Alameda County Office of Education. If I didn't say it before, ACOE, sorry about the abbreviation in the slide. And also just wanted to say that Lisa from Safe Learning is also speaking every day with the lead of our outbreak team that's working in children and youth congregate settings. So we're really working closely together. And with that, I'm going to turn it over to Lisa to talk about our COVID response for childcare and other settings and a few other issues. So Lisa, to you.
Thanks, Kiko. Good evening, everybody. Thanks for having me. So the next slide, this is a slide very similar to the one we just went over, so I won't go into too much detail, but I definitely didn't want to leave out childcare and other youth settings because we do a lot of work with our early care and education programs, as well as sports teams, camps, and all those other programs that Kiko already mentioned. And we also have other partnerships that really are crucial to us being able to do this work and to get the information out to these programs. One notable program is the Emergency Childcare Response Team, and Jen Caban is actually on this call right now, and Jen, feel free to chime in. I don't mean to put you on the spot, but the childcare response team has been an amazing partner and just helping us, organize trainings. And Jen, why don't you just, do you mind just coming off mute and telling a little bit about what you do, your team?
Sure, no problem. Good
Thanks.
evening, Lisa, and thank you for that. So the Alameda County Emergency Child Care Response Team has been operating since last March, and we've been on these advisory calls since the implementation. We've done everything related to child care, aligning the guidance, sharing information. We've done alignment with child care subsidies and emergency child care subsidies. The list goes on and on. We've held some vaccination clinics with help and support from public health. And so Lisa Erickson has been a critical partner at that table. So we appreciate it. And if there's any specific questions on who or what we've served, feel free to ask me. And we're still in implementation in recovery mode. And I say that lightly and loosely for the group.
Thanks, Jen. And then the other partner is SANCRA. SANCRA, I don't even know how to actually pronounce that, but it's basically the sports association, recreation agencies, and that's how we kind of reach our youth sport teams. And all I'll say is that hopefully we will be adding vaccination and testing to the slide. We are in conversations with our testing team around trying to support our early care and education providers more around testing. The state hasn't provided as many resources for ECE, for early care and education programs as they have for K-12. So hopefully we can come in and fill some of those gaps. So stay tuned and more to come on that. And next slide, please. And so I'm just gonna quickly talk a little bit about some of the challenges that we've had. This is pretty much, throughout the pandemic, but wanted to call out some of these high-level challenges that have been happening even more so since school reopened this fall. So one challenge is that sometimes the close contacts are notified by the school or their childcare program late. So that means that sometimes families will find out late, and that makes the quarantine sometimes confusing for families and the process a bit confusing. Just the protocols and the procedures can be very complicated. They're very technical, so it requires a lot of them calling us, we're explaining them. The tools and resources that Michelle had mentioned are all very key to helping our programs understand them. And also, children and youth settings aren't really set up to do this kind of extra level of work. They have gotten funding from the state, but it's still, even with the extra funding, it takes a while to hire staff and to train staff. And it was a kind of an unfortunate situation where schools reopened this fall at the height of the surge that we were having, in the summer surge. So that was very challenging for schools. And lastly, these are typically practices and protocols that are led by public health departments, and the schools and these, childcare settings have had to basically step up and learn these new practices and protocols in order to do the case investigation and the contact tracing. So they do that pretty much on their own. Like, we're relying on them to relay this information to families. Next slide, please. And without challenges, of course, there's going to be some successes. Just wanted to call out that, the staff in these settings for the last 18 months have been working. I know you all already know this, but I just feel like I have to just recognize the staff, that they've been working so hard, such long hours. The school nurses in particular, working way over, long hours on weekends. Childcare providers have been working from the very beginning of the pandemic, and most of them didn't even close or didn't have, that. So they've been, open since March of 2020. They've also, so another success is that districts have used the state funding to build these COVID response teams, and those have been going well in some of the districts. Very actively, all the staff and childcare, school and childcare staff, and our parks and recreation staff and sports leagues have been participating in town halls and trainings and all those weekly calls that Michelle had mentioned. And lastly, just as a result of all this prevention work and all of this, participation and hard work of the staff in these settings, we have had a low number of outbreaks in our children and youth settings because of all these prevention efforts. I think that was my last slide. Great. Thanks.
Okay, so that wraps up all that we wanted to share with you all, and there are more questions I think that you all have. And Nestor, I want to turn it back over to you because there are also questions that were sent to us that we might want to lift up and highlight. And we wanted to share something about possible survey and how we start populating our agenda moving forward.
Yes, thanks, Kimmy. I think we sent out a survey, and that's still available for all of our partners to fill out regarding what sort of questions we want to lift at these meetings, and also just some feedback for the Department of Public Health as well, and our county folks. But I think there was a question that was raised in one of the surveys, or one of the survey questions, regarding how the Department of Public Health or folks in the county plan to respond to folks who maybe not in good faith are using exemptions for the vaccine, such as a religious exemption or any other exemption. And so I'm sure that applies to the school setting as well. And so I think that was one question that someone raised around the exemptions and how to assess whether those exemptions are being done in good faith or in bad faith. No pun intended.
I think Nick is still on, and I saw the question. I wasn't sure what kind of setting they're referring to, but Nick, do you want to start off by, it really does depend on the setting where the vaccine is being required, who's going to be evaluating the documentation or lack thereof that the person is providing, if it's an employer, if it's but go ahead, Nick.
Yeah, I mean, it's usually an employer for most of these. I think the other question is different vaccine requirements have different exemptions. So there's, most employers have to provide a religious and a medical exemption, but some of these state vaccine requirements also allow you to test instead of being vaccinated. So, in that case, the stakes are a little bit lower from an enforcement standpoint. So generally speaking, the responsibility is usually at the point where the requirement is. So it's the employer. In most situations, it would be the school. In some situations, with student requirements. And I'm sorry we didn't mention this earlier, but the governor has said that there will be a vaccine requirement for students who are old enough to get a approved vaccine effective either January 1st or I think July 1st. So this is going to be an issue for schools in the future. There's a lot of nuance there.
Thank you, Dr. Maz. Does anyone I guess that captures, I don't know if any folks from the school want to add anything else, or if there's anything else to add on that part.
The only thing I would add is I think that Lisa, as she put together the challenges and the successes slide, I think that it has been really, it's been really a big mix of both. I think the schools probably should be really proud of themselves about the way they've frankly had to stand up small public health departments in their schools and in their districts in a way that they really never have before. One of the challenges that we've run into, especially with the guidance documents and things, has just been, this is new work for everybody, and their confidence in translating and interpreting that guidance document, they need a lot of backup. They need to ask the questions, even if it's in print in front of them, because they want to make sure they're doing it right. They want to make sure that they're answering to their parents and their families in the right way. It's been a really, really, really big lift for the schools. And I think that at the first few weeks of the school year, I'm not going to sugarcoat it, were pretty chaotic as all of this ramped up. I think we talked last time about just the circumstances of the Delta surge and school staff really going away for the summer, particularly this last summer, because it had been such a difficult year. And so they really, they came back in the middle of a surge and had to scramble really quickly, and people have done really well. I feel like our school situation is stabilizing. I don't feel like there's as much uncertainty. I don't feel like there's as much, I don't want to say panic, because I don't think anybody ever really panicked, but I think it was just a lot. And I think we've reached a point of stabilization. And so let's knock on some wood, cross some fingers, or do whatever your superstition is to say good, to send good wishes to our schools, because it's been a lot.
I'm going to take some liberties and just jump in and give a huge shout out to you, Michelle and Lisa, for really making this go. I mean, I'm not sure people totally understand the profound Herculean amount of work that these two women have done, and certainly have built up their teams to do, to bring it to this place. And it's just, I'm in awe of you both, and just have such deep respect. So thank you.
You're very sweet. Thank you.
And I want to echo that, and echo what all have said about just the heavy lift this has been for the schools, and all of the staff that have come together to really put together a coordinated response to ensure that our children and youth are safe in the environments that provide them with the social and emotional and educational development that we all know that they need to get back to, and that really help them to thrive. And so actually, I just want to take my hat off to all of you who have been doing that work with schools in preparation for schools reopening, because you all were preparing. All of the schools were closed for this moment. And so thank you, thank you, thank you. I know a lot of parents in my neighborhood are, thank you, thank you. So thank you for everything that you've done. I think we are very close to, we're close to the end. Are there other questions about the response?
There's a question in the chat. Kimmy, do you want me to read it?
Yes, please.
Okay. It says, is Alameda County planning on instituting vax mandates for restaurants, even though infection rates for restaurants is less than 3%? Local restaurants are struggling to stay afloat from earlier shutdowns. Limiting customers will only cause more harm.
So this relates to the question earlier about, what some of our neighbors have done in terms of requiring vaccination at bars and restaurants. And again, currently we don't have a plan to do that at the county level. I think it is certainly complicated when you're talking about regulating businesses, which we did a lot of last year, and we're sort of happy to be trying to support businesses in different ways to make their customers and their staff as safe as possible. So nothing imminent from the county on that front, from me, from the health officer on that front, but appreciate the question. And then I did see there was another question earlier that Pastor Arlene put in the chat about an outbreak at a funeral service, mostly vaccinated people. And I don't know if everybody saw that or not, but I think again, those kinds of outbreaks illustrate that COVID will spread even in highly vaccinated communities. I don't know what the outcome was in this particular case. Pastor Arlene, you can share it, but hopefully nobody got severely ill. That's really where we're looking for the vaccines to have the greatest impact. And so I think, when I hear about these stories, I think we're not out of it yet. But if people are not severely ill, that's really still what we're expecting most from our vaccines, and that's what we've seen on a broader scale. And that I think people do need to be prepared, vaccinated or not, that COVID's going to be part of our lives. We're probably going to get exposed to it over time, maybe this winter, maybe next winter. And people who are unvaccinated are going to remain at risk So lots more to talk about on this topic, but.
So are we saying it's officially an endemic, or I gotta beg the question?
Well, I mean, we're still in a pandemic wave right now. Like, we're not back to where we were in early June. We have people dying about one a day. So this is not the new normal yet. This is still pandemic wave. But I think we are going to get to that place, and we'll get there faster the more people we have vaccinated. Parts of the country, parts of the world with low vaccination rates are going to keep seeing these truly devastating waves, and until people are vaccinated, or enough people have had it and run the risk of that severe disease that we don't see these people filling the hospital. We are not there yet locally. I know people want to be there, but we're in better shape here in Alameda County than frankly most of the world.
Kimmy, I think there was one question from Dr. Bruce he asked in the chat, will you mention parental or other presence of a caretaker when a child gets vaccinated in a school setting? Other vaccination programs in schools did require a parent presence versus just a paper saying it's okay.
Lisa and ACOE folks. This is a question for you all.
Yeah, and feel free if there's anyone here from the vaccine operations team too to chime in. But the state actually set guidance around minor consent for vaccine, and they allowed for for vaccine to happen without the parent being there to be present. I think to make it more convenient for families and easier to vaccinate youth. So that's where we're going with the state guidance around that. And we have an infographic that I was trying to look for to share with you that I can't seem to find. So it's where if you have that handy, please share it in the chat. And then there's also guidance from the state that I can share with you too, that talks about minor consent.
Sandy, did you want to add anything? Sandy is setting up our vaccine operation.
No, I think Lisa covered it. We wanted to make it as simple as possible for young people to get vaccinated. It is sometimes more inconvenient on the vaccinators, and when the parents are present, but we did want to make it as available as possible and follow the state guidelines.
Okay, so thank you, Lisa and Sandy, for that. We are now at time. I just want to remind us that we have a survey out there that asks what we would like to continue to see addressed in these meetings, as well as what any feedback that you all may have for us. We, as a reminder, have a meeting in November, and let's see, the meeting date is Tuesday, November 9th at 5:30. And maybe as part of the survey that you all will be filling out, we will also ask you what's your take on whether we should meet in December or not. And I know folks are doing holiday stuff, so we want to be mindful of that. But thank you all for being here. Thank you to our interpreters, our multiple language interpreters, who always do a wonderful job. Please take a look before you go at Lauren's beautiful baby, who is serving as the Zoom backdrop right now. And we can maybe even pin her to the top. Again, thank you for taking the time to be in this space and your continual efforts in combating this viral enemy that we have and that we've been holding off, I think, and doing our part in trying to keep everyone safe. So thank you all for your time tonight, as always, and we'll see each other soon, I hope.
Good night, everyone.
Good night, everyone.
Have a good one.